prenatal period. The prenatal period, it is a time when fetal morphogenic substances have an organizing or differentiating action on the neural tissues mediating mating behavior. All the developmental theories which we lengthily discussed dwelt on the developmental process after birth, so none of them was concerned with what development went on before birth. So, to make the description of human development complete, it may be good to understand the beginnings of the child and adolescence. So, the learners of how it all began in the process of the development, so inside of the womb of a mother. We must learn how we all begin and created. Each of us has its own purpose in life. The stages of prenatal development. So, first is the germinal period. So, the germinal period from conception to 2 weeks. So, prenatal development that takes place in the first 2 weeks after conception. So, the second is it includes the creation of the zygote, continued cell division, and attachment of the zygote to the uterine wall. Number 2 is embryonic period, between 2 weeks to 2 months. So, prenatal development occurs to 2 to 8 weeks. The zygote will become embryo, organogenesis, and there are three layers of the cell. So, the first is endoderm. So, the inner layer of the cell becomes the digestive and respiratory system. So, the second is ectoderm. So, the outermost layer of the cell. So, it becomes the nervous, sensory receptors, and skin parts. So, the third is mesoderm. So, the middle layer and develops into the circulatory, skeletal, muscular, excretory, and reproductive system. As the three layers of the embryo form, the support system for the embryo develop rapidly is the three life support is the placenta. A life support system that consists of the disc-shaped group of tissue in which small blood vessels from the mother and the offspring intervene but do not join. The two is umbilical cord. So it contains two arteries and one vein that connects the baby to the placenta. Amnion is a bag or an envelope that contains a clear fluid in which the developing embryo float. Fetal period lasts from about 2 months after conception until 9 months when the infant is born. Dramatic course and organ system mature to the point at which life can be sustained outside the womb. Teratology and hazard to prenatal development. Number 1 is prescription and non-prescription drugs. Letter A. Prescription drugs, thalidomide, and antibiotics can be harmful on the developing fetus. So, letter B. Non-prescription drugs. The mother should be careful from the time on conception anything she intake the unborn child absorbs. A paracetamol can also considered as non-prescription drugs. There are the three non-prescription drugs is one is diet pills, number 2 is aspirin, number 3 is coffee, psychoactive drugs. Pregnant women who drank caffeinated coffee were more likely to have preterm deliveries and newborns with lower birth weight compared to their counterparts who did not drink caffeinated coffee. Heavy drinking by pregnant women results to the called fetal alcohol syndrome. Number 3. Environmental hazard. These include radiation in job sites and X-rays, environmental pollutants, toxic waste, and prolonged exposure to heat saunas and bathtubs. A pregnant woman's core body temperature will often rise to about 37.8 degrees Celsius when it is normally 37 degrees Celsius. The extra blood not only helps the body meet and metabolic needs of a growing fetus but also flows to other organs like kidneys, So, try imagine if the mother has an exposure to above temperature. Inside of the womb is hotter whereas the fetus also cold feel. The high temperature due to fever may interfere with cell division and may cause birth defects and even fetal death if the fever occurs repeatedly for prolonged periods of time. For instance, early exposure to lead affects children's mental development. Maternal factors. A developing fetus depends entirely on its mother for nutrition. It is recognized that maternal nutrition during pregnancy may result to inadequate growth of the fetus. If a fetus does not receive nourishment, the rate of the cell division is seriously hampered. Rubber, German measles, syphilis, genital herpes, and AIDS are teratogene. So, a lack of the folic acid in the mother's diet leads to a birth defect on the brain and spinal cord. So, the high anxiety and stress in a mother are linked with less than optimal prenatal and birth outcomes. Though maternal ages periods can lead to the problems before the offspring development, so adolescent and the 30 older. Paternal factors. Paternal factors that can adversely affect prenatal development include exposure to lead radiation, certain and petrochemicals. Older fathers may place their offspring at risk for certain defects. As in the case of older mothers, older father also may place this offspring at risk for certain defects. Week 11, the topic is physical development of infants and toddlers. So, we have just traced the developmental process before birth. So, let us continue to discover the developmental process by following the infant of newborn up to when reaches age. The period that comes after prenatal of the antenatal stage is infancy, which in turn is followed by toddlerhood. So, infancy and toddlerhood span for the first 2 years of life. So, between birth to 1 year of age, babies grow and develop at an astounding rate. So, they learn to smile, roll over, so sit up, wave, clap, pick objects, scroll, bubble, and some may even start saying few words. So, they learn to bond with the trust of their caregivers and they often understand more than they are able to communicate. Babies enjoy music, movement, and simple games like peekaboo. So as they get older, they learn to express more emotions. Toddlers may be considered children that range from 1 year to 2 years old and the toddler age to be around ready to transition into a preschool. Week 12, Cognitive Development of Infants and Toddlers. So, babies are not only growing physically during the first 2 years of life, but also cognitively, mentally, every day while they interact with and learn about their environment. They are creating new connections and pathways between nerve cells but within their brains, in between their brains and bodies, while physical growth and change is easily observed and measured in precise terms such as in inches and pounds. So, cognitive change is and development is a tight little harder to determine as clearly. Therefore, much about what experts know about mental and cognitive development is based on careful observation of development theories and their theories such as Piaget's theory of cognitive development and Erickson's psychosocial stages